Welcome to Healthy Universe with Dr. Ahmed Rushdi. I am a physician nutrition specialist and today's topic is salt intake. Let us look at the dietary guidelines of America released on the 7th of January 2026. The guideline says an adult should not exceed 2300 milligrams of salt per day. Compared to the 2020, in 2025 to 2030 guidelines, they have also given an age-specific guideline. Between 1 to 3 years, they recommend 1200 milligram. Between 4 to 8 years, they recommend 1500 milligram. And between 9 to 13 years, they recommend 1800 milligram. Apart from that, there is an allowance for athletes and sports personnel that they can increase their salt intake depending on their losses. Therefore, this is a comprehensive guideline. Can you understand anything regarding 2300 milligram of salt? Do you know how to manage that? Let me tell you. Look at this spoon. This is a small teaspoon which is 5 gram. 2300 milligram is 6 grams in total. 1 teaspoon is 5 grams. Our daily recommendation for each individual is 6 grams of salt per day. That means you should take only about a level scoop of this teaspoon. That is enough for the whole day, including your meals and snacks. The easiest way to look at this is home economics. Let me tell you how you should calculate it. How do we know that we are exceeding the limit or within the limit? There is a practical way. Consequences of high salt intake. If you are taking excess amount of salt, you are at a risk of developing hypertension. Now let's come back to the practical way of understanding whether you are taking excess salt at home. The easiest way to understand that is your purchasing power. Let's say your family has 4 members. Each member needs 6 grams of salt if they are above 13 years. In that case, your total salt intake for the month for the family should not exceed 720 grams. In that case, you can very well manage with a 750 grams of salt packet for the whole month. If you are purchasing more than that, definitely your salt intake is more. For the whole month, your crisps, your sausages, your processed foods, your packeted milks, why do they include salt in this particular food is because to make it more palatable. When the food is more palatable, more people will buy that and more people will eat that and more people will eat more quantity. The more you eat these processed foods, your salt intake is going to go high. Apart from the salt which you are using in cooking. Therefore, number 1, we should avoid ultra processed food. Number 2, you should reduce the salt according to your monthly purchases. Then you will understand over a period of time whether you are exceeding the limit or not. Number 3, natural food, natural meat, normal vegetables also contain salt. Therefore, we need to count all 3. I have also made a pyramid according to the dietary guidelines of America. They have just mentioned as 2300 milligram per day. In that, I have put the processed food as in the base, then natural vegetables and the meat, then the added salt. Now you know the recommended salt intake according to the age, how much you should take, how can you understand whether you are taking enough salt or not, or whether you are taking high salts which will put you into a threat of developing hypertension. Now, interesting part. How can you reduce the salt intake? $1 million question. According to the scientific research, within 3 to 6 weeks, you can come down on salt slowly. This needs a rehabilitation kind of a program. I hope that I have given a small overview on the salt intake according to the dietary guidelines of America, which is universal. It has not changed over a period of last 10 years. It remains the same because the research evidence is very high. Therefore, we will count our salt and we will eat accordingly. Thank you very much. I am your doctor, Dr. Ahmed Rushdi, physician nutrition specialist. Thank you.